Hello, and welcome to another episode of BioNexus Health Podcast series. Today, we will be speaking with Chantal from Arizona. Chantal and her son have had a deeply healing journey with natural medicine. Chantal is going to share with us the details of her recovery, herself and her son, their recovery from Lyme disease, mold biotoxin illness, and how she found the courage to go through everything that herself and her family had to endure trying to get well from chronic Lyme and chronic inflammatory response syndrome. I would like to welcome to the podcast today Chantal.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
Hi, Chantal. How are you? Welcome to the show, and thank you for being here today.
Thank you, Dr. Jodie. Thank you so much. I'm glad to be here.
I met you a couple of years ago, and I'd like to start off by asking you, what made you look into natural medicine, herbal medicine? What was going on with you?
It started out when I was pregnant. There was some anomalies with my only son, Jake, and when he was born, he had some issues.
Okay.
It looked like autism. So I didn't know how to go about it. And it was very difficult to get any answers from regular doctors. So I did that for a while, feeling like I didn't have many answers. Prior to that, I went to doctors when I had issues, but I still try to maintain my health by exercising and eating healthy. But I didn't really understand like that there was more to it as far as the natural approach goes, and that there was other people that could actually help me on my journey. So it started maybe like 3 to 4 years after I gave birth.
Okay.
When I started like my journey in really exploring supplementation and herbal remedies, homeopathy, things like that, chiropractic care, acupuncture, those sorts of things. Yeah.
I was saying, sorry, you know what's going to happen? I'm going to interrupt you if I want to get more information, and you feel free to do the same.
Sure.
So, it makes for a very interesting conversation then.
Yes.
What I was trying to say was that I think you were a runner, right? You were an athlete.
At one point when my son was about 5, yes. I was running. I got up to about 20 miles. As it was like hiking, running in the mountains. So I really enjoyed that, but I got burnt out, and I didn't supplement myself in the way that I should. So it's all about balance now for me.
Yes.
Yes.
And if I'm not mistaken, that was in your old house, right? Which had moisture issues. It was water damage, so it may not necessarily have been a burnout. It could just have been mold exposure, which reduced the capacity of your lungs and exercise and what have you, right?
I think so, because I felt very out of breath, more out of breath than other people, and I knew I was in condition and I could do it, but just tended to get very out of breath. Yeah. So.
And how did you hear about BioNexus Health, and what brought you to me?
Nicole, if I could say, Nicole Bruce.
Yes.
Yeah, because I was telling her about symptoms that I had, and I know she was going through stuff, and she I wasn't open to it at first, because I was tested for Lyme and it kept showing up negative, and I just had to get that out of my head that there was other ways to go about testing for Lyme. All the symptoms that I mentioned to her, she was like, that sounds like you have Lyme and mold issues. And with enough prompting, I decided to call and to see if I could get some answers.
So now I'm a bit curious, did Jake ever get diagnosed on the spectrum, or, were you suspecting and then he just kind of, he's always been high functioning?
I would say he's always been high functioning, but he did have to go for, I can't remember the name of it. It was like help from the school district.
Oh yes, early intervention.
Yeah, he did do that for,
okay.
I think it was like, it ends at 4 years old. So he did it for like a year and a half. They noticed he had some issues and they worked with him, and it did help, He was never formally diagnosed with autism. I kind of shied away from the label,
right?
Because I wanted him to be able to grow in his own skin and to, figure it out on his own without having the label. Yes. But and he's homeschooled, so I feel like that kind of helped a little bit. But
it does, I've heard a couple things that come to mind. Is one is a mold pregnancy, so to speak, a pregnancy that is carried to full term in a water damaged building. It could be, all day exposure or partial exposure. I've had some moms where the office, the work area was water damaged, whereas the residents seem to be okay. But there is a lot of diagnoses of being on the autism spectrum disorder for moms who've carried a moldy pregnancy, so to speak, to full term. So that's quite interesting, and it would have been myself as well. Hindsight, it would have been myself. We had basement issues, a small area, but it was definitely exposure before those things, before that little area in the basement was fixed. So definitely.
It's crazy. I know once you get out of molds, you realize, and then you can go back and think about the other places that you were in.
Yes.
And I had different side effects each place I was in.
Yes.
And like you have these instincts, that something's not right. And I always had in the back of my mind, actually, that it might have been mold, and people kept suppressing that for me. I wouldn't have known how to go about it anyway, other than, moving to a new location. But I mean, you really did open my eyes on how to spot it, how to look for it, how to avoid it. So that's really, really helped me on my journey. Yeah.
So let's get into it a little bit more. So we got started with you, we did a lot of testing, and yes. you actually found that mold biotoxin illness, Lyme disease. Do you remember all of that? I'm sure you do. If you want to talk about it.
Well, I think it's very hard to get outside of your head sometimes. Mm-hmm. And I started with your Lyme protocol, but I just had trouble with the mold thing too, because it is such a big step. So I was on your Lyme protocol for a year, and I felt like there was something missing. And so maybe it was a little less than a year. And then I started saying to you, okay, let's tackle this issue, because I feel like that's the last step of, my journey.
Getting healthy. Yeah.
Yes.
Getting back to health again. Right.
Yeah.
And you also brought your son Jake to me. He was what, 11 at the time?
Now that I don't remember. Yeah, I think it was like 10 or 11. We did it together, because we do everything together. When we go for healing and health, it's like you're getting acupuncture treatment, I'm getting an acupuncture treatment. We're both going to Dr. Dashore together. So yeah.
That's how it is with myself and Brian as well. Since we went through so many of the same things with Lyme and co-infections and mold biotoxins. And so, yes, we did so many alternative treatments.
Yeah.
He got treated all over the world. I was there. I'm like, yeah, me too. Let me get some health and wellness going.
Yeah.
For myself as well. Yeah. So how
honestly, it could be a little time consuming.
Yes.
It's because it is a lifestyle change. Yes. So if you can do it together, it's easier than making separate appointments.
Oh, most definitely. In fact, many of the world-renowned naturopathic holistic practitioners that I met for Brian and that I mentored with, I was very fortunate enough to mentor with them as well. One thing I learned was, many of these world-renowned pioneering practitioners will not treat the child, but they usually advise on treating the whole family as a single unit, because you are that child's universe. Whatever you bring home from wherever you go out in the world, it's the child is exposed to that. And mom, dad, and the family, rest of the family, become reservoirs of good things, bad things, in between things, whatever, strep carriers, COVID carriers. So you just have to be willing to jump right in and be all in, pretty much, more or less. So I kind of agree with you there.
Yeah. It's a journey, because the allopathic medicine, they kind of offer that you're going to take something and then that's it, you're going to feel better. That's not how life works. I'm sorry. Because it's a journey, you know what I mean? It's a journey, and there's a lot of side effects with the allopathic that, I was caught up in that for a while, and I just knew that there was a better way, and I just had trouble tackling it at the beginning. So yeah, I'm all in now. It's a journey. It really is like a never ending journey. You have to keep up your health, and you have to be aware of, what you're consuming and,
where you're living. I mean, you're saying journey, and that makes sense because, and you also said never ending journey. Well, when it comes to having health and wellness, I don't mind if it's a never ending journey. I have my health, I have my wellness. I've heard many moms who are on a naturopathic path themselves, with daily consumption of Mother Nature's bounty, with herbal medicine every day for like prophylaxis, right, as preventative. And I hear them, when they go to the dentist's office or when they go in for any surgical procedure, if it's needed, they're always asked, well, you're almost 60, you're 50, you're 65, 70. I mean, I've got 75-year-old ladies that are not on a single prescription medication, like none.
That's amazing.
Yeah, isn't that so?
That's my aspiration.
It goes to show you that's possible.
It is possible. Yeah, I agree.
Yeah. And I just heard the other day, Luana mentioning that it was difficult for her dental surgeon to believe that she was not on any prescription medications, like nothing. So she says, no, why should I be? Like, why should, but you're 72. So
exactly.
Right. So I'm surprised. Not surprised. Luana said that, she was almost going to tell him that, I practice bush medicine.
They wouldn't get that. I'm sorry. Yeah.
So tell me, what improvements did you see? You were only doing herbal supplements right, herbal protocol, fully plant-based. And what improvements to your health did you see? And after you talk about yours, let's also talk about your Jake.
I think, what is said for me is probably said for Jake. We're alike in a lot of ways. I think we had a lot of neurological issues that were unresolved. That was the major thing. And when we started the herbals, that helped tremendously.
Okay.
Yeah, the neurological, like the brain fog and the sleeping issues, the concentration issues. So I noticed a huge improvement in herbals, because it's like a roller coaster in general, and like that helped me even me out. And that was like, some things would improve and not improve when we weren't on herbals. So I'm like, okay, we can kind of function, but the neurological thing just had us like, and the fatigue was another big one, the fatigue. So those things were really helped tremendously. Yeah.
What about gut issues? What about
Gut? Yeah, I know there's just, we have so many like issues in general, and gut, we're still working on that. And I think our diet can be improved somewhat. I have a teenager now, so it's difficult for me and him a little bit, but yeah, the gut issues is another big one. I think, for me, that, and you can correct me, but for us, our gut issues like translates to a lot of other issues that we have. And if our gut feels healthy, then a lot of our other symptoms improve. Yeah. And so
yes,
that has helped with herbals for
good.
sure. Yeah.
So yes, I would agree with you. Gut health contributes to whole body well-being.
Yeah.
Is what I've observed. And I'm sure many people, listening will also agree with that. I mean, it's not just the gut-brain connection. Now they are speaking out about the gut-lungs connection. I think
Wow.
I think the gut has, that's the central processing unit of your body, isn't it? Like the CPU of your body, where there's nutrition, right? Nutrients are absorbed, and then they are distributed throughout the body from there. You have hormones coming up, you have neurotransmitters, you have the immune system, inflammation, all of that.
Inflammation. That's another one that helped with the herbals, is inflammation.
Inflammation.
Big time. Yeah. Yeah. We had a lot of inflammation too. And that translates to your brain too. I mean, I can tell when I have inflammation in my brain, especially when I've been exposed to mold.
I was going to ask you that next, actually. You must be psychic, because that was the exact question I had in mind, that, you're one of the people that I know that have had unfortunate re-exposures, right? One was some furniture that you bought from somewhere. And then, so you just immediately feel
something's
well
wrong
again. You feel unwell again, right? And it gets,
it's crazy. Because when we first moved out of our house into our apartment, and then we get a couch, you have you got to push through the naysayers. Because even my family, I said, this couch is moldy. As soon as they unwrapped it, I'm like, this couch is moldy. No, it can't be moldy. It's new. I'm like, it's moldy. We had that couch in my place for about 2 months. I refused to sit on it, but I just let it. I accepted that the couch was in there, but I just didn't sit on it. One of the tip-offs was my father, which still doesn't see the connection. I think, it runs in the families too. And my father came over and he sat on the couch. And he started getting this thing in his throat and in his
Mm.
nose, and it was tickling. He says, every time I sit on your couch, I feel like I'm getting a cold. I'm like, okay, that's it. So what I did is I tested underneath the couch with mycometrics, and then I tested the rest of the apartment. It was astronomically high, the mold underneath the couch. It was so high that when I went to the place I bought it from, I showed them, and people don't understand mold. I showed them the 2 tests. They couldn't deny it. And they took the couch back free of charge.
Okay.
So it was, yeah. And it took a while, it takes a while to get back too after you get exposed.
Exactly. Yes.
Yeah.
It takes a while. If you're re-exposed, sometimes, certain symptoms get worse than they were the first time around.
Yeah.
That's now you have been able to remediate and sell the old house, and you moved into an apartment, right? Apartment, you then had, in the beginning, I remember you had EMF sensitivity issues, right? You had the meters right on your wall or something?
It was high EMF environment, and we took the mitigation steps and it alleviated it. Yeah. So we did some things with your help, and guidance, and we mitigated. It wasn't perfect, but it's very hard to mitigate EMF, I have to say. Very hard. We have some issues here as well.
Oh, you do? Okay.
Yeah, I'll talk to you later about that one. But yeah, we have some EMF. It's hard to know, especially if you're moving to a place that we took a chance on this place because we moved from New Jersey all the way to Arizona. So, I mean, it could have been a big flop with mold too, but I was very careful with the place I chose, and I did as much research as I could before we moved, and fortunately it is working for us. So
yes. And you moved into new construction, didn't you?
New construction, no basement.
No basement, right? Dry climate.
Dryer. Although, I mean,
It's been raining.
Arizona, oh my gosh, the monsoon seasons, nothing like these, because it's like every rainstorm is like a hurricane.
Oh, seriously? Oh, I wasn't aware. Oh, wow.
We're getting a lot of rain. It's, we're just getting used to a whole new environment. So,
Yeah.
and that's difficult too when you're dealing with mold, when you have to get used to it's totally different from the East Coast.
Yes.
But,
okay. I had another patient the other day from Flagstaff, Arizona.
okay.
And she mentioned the monsoons, and I wasn't aware, Arizona had a monsoon season, and now today you're mentioning it. So interesting. Okay.
So, I mean, but that would make sense that people don't equate Arizona with mold. All the rain I'm seeing, there's just no real safe place. You have to be very vigilant.
You do. You absolutely do. You need to have all the precautions in place with your furnace, with your home, with air purification. You also need precautions when you're out and about, hiking and mountaineering and walking the trails. Most of us love to do that. I love to be on my farm. You must have seen some photographs that I posted as well, right? Yeah. Thank you. So I like to be there. So, but I try and make sure that I have to make sure that I'm well sprayed. I'm wearing long sleeves and long pants. So nowadays they make everything. I actually forget the brand name. I wouldn't want to say it anyways, but they have these super lightweight organic cotton clothes.
Okay.
Which are like long sleeves and long pants, and you don't really feel like you have them on. This is what I found something similar in very tropical climates, like Fiji or south of India, some maybe the Caribbean as well. They have really lightweight cotton clothes.
That sounds nice.
Yeah.
Cotton is good. Yeah, it's hard. It's harder and harder to find natural, even in your clothes. So yeah. Mm-hmm.
How did you are you both, you and Jake, in a good place now overall? And I know you haven't done any allopathic in the last few years, and your health has been improving overall, other than the couple setbacks you've had with re-exposure. So Jake is actually a tall, strapping young man now.
Taller than me.
Oh,
Right.
God bless. Wow.
Yes, that just happened in the last month.
Okay.
Yeah.
Good, good. So both of you are in a good place currently, doing okay?
Yeah. We still have some fatigue issues that we're dealing with. And I do have to talk to you because I think we did get COVID.
Oh, you did? Okay.
Yeah, so that's something that we gotta, discuss with you. I've been meaning to do that. So,
Yeah.
like I say, never ending journey. You never, things get thrown at you and
But you know what? I'm sorry to interrupt, but you know
go
what?
ahead. Give me some encouraging news after I think we got COVID.
I mean, yes, no, you're sitting there, right? Looking beautiful, and you're at peace, and you're telling me that looks like you got COVID. So now people who get COVID don't talk like that. They're like panicky, oh my God. But like I've told you, you're doing a full herbal protocol. There's no way that it's going to get severe. Like I've been exposed 3 times, right?
Okay.
And also remember, you approximately for about a year you will have immunity. So it's just right. And another thing is that both of us are not vaccinated. We are never going to be. And I just love it when you said that, hey, I had COVID. I think I just need to talk to you about it. Not like,
but see, like we got really sick.
yeah.
But you know what? Like there is peace and reassurance in that that you're gonna get better. You've been in like similar places before, and that you're gonna get better.
Absolutely, absolutely. I just recorded a lecture for the Autism One International Conference just yesterday. They had asked me to speak about the similarities between CIRS and the ARS, which is the acute respiratory syndrome that happens with COVID. There are so many similarities right down to the cell and the immune compromise that is seen with CIRS.
What is that again? CIRS?
Oh, that's the mold, the mold biotoxin illness, chronic inflammatory response syndrome.
Okay. You see that? I should know that. That's crazy. Yeah. I just say like mycotoxin illness,
That's fine. Same
yes,
thing.
CIRS. Yeah.
Same thing, yes.
Now I remember.
Yeah, it's very interesting. Some say CIRS, some say CIRS, some say CIRS, whatever. It's all the same thing. It's mold illness.
Yes, gotcha.
Yeah. Good, good. Well, I am so glad you were able to make time for talking to me today. I appreciate it.
No, I'm happy I did this. Yeah.
Good.
Anything for Dr. Dashore.
Oh, thank you.
I love you. You've helped us a lot.
Thank you. Well, Chantal, I certainly reciprocate that sentiment. I'm glad that you and Jake are doing well, and I'm sure listening to this podcast, it has helped many people understand the many benefits of natural medicine. That it's good to know that there are options and alternatives out there.
Yes, there is. Yep. Thank you so much too.
So this brings us to the end of this episode of BioNexus Health Podcast. I hope you will join me next time, and I hope this podcast has been beneficial to you. Thank you for joining me today. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast. You can subscribe for free on most podcast apps. By subscribing, you encourage the algorithms to spread our messages of hope and healing. You may also leave a review on your preferred podcast app or share on your social networks to promote the podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold, biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. For more information, visit BioNexusHealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.